When we seek medical care, we often focus on the cost of tests, treatments, or medications. We rarely consider how our doctors are paid. Yet the way healthcare providers are compensated significantly impacts the cost and quality of the care we receive. It's the invisible hand guiding medical decisions. Traditionally, healthcare in America has operated on a fee-for-service model. This system incentivizes volume over value. Doctors are paid for each service provided regardless of the outcome. While this seems straightforward, it can lead to a focus on quantity rather than quality. The way we pay doctors influences their behavior. If they are rewarded for doing more, they are more likely to do more, even if it's not always necessary. This raises concerns about overtreatment and unnecessary procedures. Moreover, fee-for-service models often fail to adequately compensate for preventive care or chronic disease management, which are essential for long-term health. Ultimately, the way we pay for healthcare shapes the kind of care we receive. The fee-for-service model, while seemingly logical, has come under increasing scrutiny for its potential to drive healthcare costs upward. Under this system, every office visit, test, procedure, and consultation generates a separate bill. Imagine a patient with a common cold visiting a doctor who is compensated through fee-for-service. The doctor might feel pressured to prescribe unnecessary antibiotics or order a battery of tests, even if a simple course of rest and fluids is all that's needed. This emphasis on volume over value has contributed to the overuse of medical services, driving up costs without necessarily improving health outcomes. Furthermore, fee-for-service models often fail to incentivize preventive care. Regular checkups, screenings, and lifestyle counseling, while crucial for preventing illness and managing chronic conditions, are often poorly reimbursed under this system. Addressing the shortcomings of the fee-for-service model is paramount. In contrast to fee-for-service, capitation offers an alternative approach to physician compensation. Under this model, providers receive a fixed payment per patient for a defined period, regardless of the actual services provided. Proponents of capitation argue that it encourages providers to focus on keeping patients healthy. Since they receive a set fee, there is a financial incentive to prevent illness and manage chronic conditions effectively. However, capitation is not without its critics. Some argue that it could lead to undertreatment, as providers might be hesitant to provide necessary but expensive care if it eats into their fixed payment. There are also concerns about providers cherry-picking healthier patients to maximize their revenue. The success of capitation hinges on setting appropriate capitation rates and monitoring quality of care. Section 4. Beyond the basics, exploring other payment models. Beyond fee-for-service and capitation, a range of other payment models are being explored to address the challenges of healthcare costs and quality. Fee schedules involve predetermined prices for specific medical services, negotiated between providers and payers. Discounted fee-for-service models offer reduced fees for services in exchange for meeting certain quality or efficiency benchmarks. Diagnosis-related groups, or DRGs, and per diem payments are commonly used for hospital reimbursements. DRGs involve fixed payments for specific diagnoses, while per diem payments provide a set amount per day of hospitalization. Salary models, where providers receive a fixed salary regardless of the number of patients they see or services they provide, offer another alternative. This approach can reduce the financial pressures associated with fee-for-service but might not incentivize productivity or efficiency. Section 5. Sharing the risk, sharing the responsibility. To further align financial incentives with quality and efficiency, various risk-sharing tools are being implemented in conjunction with different payment models. Withholds involve temporarily holding back a portion of a provider's payment, typically a percentage of their fee-for-service reimbursements or capitation rates. These withheld funds are then released if the provider meets predefined quality or cost targets. Risk pools involve pooling together funds from multiple providers or payers to cover potential losses associated with high-cost patients or unexpected healthcare expenses. By sharing the financial risk, providers are encouraged to collaborate on care coordination and cost containment strategies. Pay-for-performance, or P4P, programs offer financial rewards to providers who meet specific quality benchmarks, such as improved patient outcomes, increased preventive care utilization, or enhanced patient satisfaction. These programs aim to incentivize providers to go above and beyond basic care standards. Section 6. Finding the balanced quality care without breaking the bank. The ideal healthcare payment model remains elusive. The current landscape is characterized by a move away from pure fee-for-service towards more value-based models. This shift involves a greater emphasis on quality metrics, patient satisfaction, and cost-effectiveness. Providers are increasingly being evaluated not just on the quantity of services they provide, but also on the value they deliver. However, transitioning to value-based care requires a fundamental shift in mindset and infrastructure. Providers need access to robust data analytics to track performance, identify areas for improvement, and demonstrate the value they provide. The key is to create a system that aligns the financial incentives of providers with the best interests of patients. Section 7. The future of healthcare payments. A blended approach? As the healthcare landscape continues to evolve, so too will the ways in which we pay for care. The future likely holds a more nuanced and blended approach to provider compensation, moving away from the rigidity of traditional models towards more flexible and adaptable systems. One emerging trend is the concept of bundled payments, also known as episode-based payments. In this model, providers receive a single payment for an entire episode of care, such as a surgical procedure or the management of a chronic condition like diabetes. This encourages collaboration among providers and incentivizes them to coordinate care efficiently throughout the patient's journey. Another area of innovation lies in the use of technology to enhance payment models. Telehealth, remote patient monitoring, and data analytics are transforming the way care is delivered and paid for. By understanding the complexities of provider compensation and embracing innovative payment models, we can strive to create a system that delivers quality care without breaking the bank.